Hey, future RN, you know loop diuretics like furosemide are without a doubt one of the most tested medication classes on the NCLEX. You're going to see them pop up in questions about heart failure, edema, and hypertension all the time. So today, we are going to break it all down: how they work, the biggest side effects, what to monitor, and the patient teaching you need to know so you can absolutely ace these questions. Welcome to ClearPath NCLEX. This is your go-to channel for high-yield content that's designed to help you pass on the first try.
Okay, let's dive right in. And really, I'm not kidding, getting a solid handle on these drugs is pretty much non-negotiable for doing well on the exam. We're going to cover what they are, exactly how they work their magic, the key side effects you have to know, and the patient teaching that's going to make all the difference. So here's our game plan. First, we'll start with the basics of what loop diuretics even are. Then we'll get into the nitty-gritty of furosemide and how it works. And we're going to spend most of our time on the side effects and monitoring. Because, trust me, that's where the NCLEX really loves to focus.
So first up, what are these things? Well, to put it simply, when you think loop diuretics, I want you to think powerful. These are the heavy hitters, the strongest diuretics we have in our toolkit for getting rid of a whole lot of excess fluid.
Here's the core definition, and the name really tells you everything. It works on the loop, specifically the loop of Henle in the kidney's nephron. Its entire job is to slam the brakes on the body reabsorbing sodium and water, which forces all of that extra fluid out through the urine. We'll get more into that in just a second.
So why would we need something so powerful? Well, we bring out the big guns for really serious situations where there's just way too much fluid on board. I mean, think about a patient with heart failure who literally feels like they're drowning. That's pulmonary edema. We also use them for really bad swelling from other conditions, and sometimes for high blood pressure. And here's an interesting one to file away: hypercalcemia, because these drugs also flush out calcium.
All right, let's zoom in a bit. We're going to focus on the one drug you absolutely, positively have to know inside and out for your exam: furosemide. Furosemide, which you probably know by its brand name Lasix, is the classic loop diuretic. And here's a little NCLEX pro tip for you. Notice that "-ide" ending. Most loop diuretics end this way: furosemide, budesonide, torsemide. It's a great little memory trick that can help you spot the drug class in a question right away.
And this drug is incredibly precise. It doesn't just work anywhere in the kidney. Nope. It targets a very specific spot: the thick ascending limb of the loop of Henle. See? The name loop diuretic really does tell you exactly where it works.
Okay, let's make this super simple. Here's how it works in 4 steps. 1. Furosemide blocks a special channel. Think of it like putting up a roadblock. 2. Because of that roadblock, electrolytes like sodium, potassium, and chloride can't get back into the blood. They're trapped in what will become urine. 3. And what always follows sodium? Water. So if all that sodium is stuck in the tube, a ton of water stays right there with it. And 4, the result is a massive increase in urine output. It's a really powerful chain reaction. Okay, everyone, lean in for this part because this is the most important section. The NCLEX absolutely loves to test your knowledge of side effects and what you, as the nurse, are supposed to do about them. This is where you're going to score those crucial points. If you only have room in your brain for 3 things about furosemide, make it these 3. Number 1, the biggest, most tested side effect is hypokalemia. That's low potassium. Number 2 is ototoxicity, which is hearing damage. This is a big risk with high IV doses given too quickly. And number 3 is dehydration, which leads to hypotension or low blood pressure. You will see these concepts over and over again. So here's your nursing action plan. For hypokalemia, you've got to monitor that potassium level. Anything under 3.5 is a red flag. And watch for muscle cramps. This is especially important if your patient is also on digoxin, because low potassium makes digoxin toxicity a huge risk. For ototoxicity, you need to ask your patient about any ringing in their ears, also known as tinnitus. And here's the key nursing action: push IV furosemide slowly. For dehydration, you're monitoring blood pressure, heart rate, and daily weights. A sudden drop in weight means they're losing fluid fast. And don't forget, it also flushes out magnesium and calcium, so keep an eye on those levels too.
Now, what are you going to tell your patient? Your teaching needs to be crystal clear. First, tell them to take their dose in the morning. Why? So they aren't running to the bathroom all night long. Second, they have to weigh themselves every single day, at the same time using the same scale. This is the absolute best way to track their fluid status. Encourage them to eat potassium-rich foods. Think potatoes, bananas, spinach, to help replace what they're losing. Also, teach them to change positions slowly to avoid getting dizzy from a drop in blood pressure. And finally, They have to know to report any ringing in their ears or new muscle cramps immediately. All right, you've got the knowledge down, so let's put it to the test with a few quick NCLEX-style questions. I'll ask the question, you can pause and think for a second, and then I'll give you the answer and a quick reason why. You've got this. First question for you. Think about the name of the drug class. Where does it work? And the answer is the thick ascending limb of the Loop of Henle. That name, loop diuretic, is your biggest clue. Question number 2. Now this is the big one. Which electrolyte are you worried about the most? You got it. It's hypokalemia. Low potassium is a top priority for the NCLEX because it can cause life-threatening heart rhythm problems. Okay, let's try a scenario. Your patient just got IV Lasix, and now they're telling you their ears are ringing. What's going on? The answer is ototoxicity. That ringing in the ears is a classic sign, and that's exactly why we always give IV furosemide nice and slow. Okay, last question. When you're assessing your patient, what's the most important vital sign to monitor to see if the drug is working and to watch for danger? And the answer is blood pressure. A drop in blood pressure can mean the drug is working, but too much of a drop is a very dangerous side effect. And of course, remember that daily weight is your #1 way to check their fluid status. Phew, we covered a lot. Let's wrap this all up with a quick little cheat sheet. Seriously, if you're going to screenshot one thing from this whole explainer, this is the slide to do it. These are the must-know facts for your exam. Okay, the essentials. The drug is furosemide, and it works in the Loop of Henle. Your top 3 side effects to remember are low potassium, ototoxicity, and dehydration. You're going to monitor their potassium level, their blood pressure, and their daily weights. And you're going to teach them to take it in the morning, rise slowly, and eat potassium-rich foods. If you can master these points, you are going to crush every single loop diuretic question that comes your way. You are doing an amazing job. Keep studying. You've totally got this. Thanks so much for watching ClearPath NCLEX. If this helped you out, please give it a like and subscribe for more high-yield content. And don't forget to hit that bell so you never miss the next game-changing NCLEX tip. Drop a comment below and let me know. Which side effect you always remember first? I read every single one. I'll see you next time.